Greetings, friends. I'm Dr. Artem Park. Today, we're going to relieve pain caused by sciatic nerve compression on our own using exercises. In other words, we'll be unlocking our sciatic nerve. Unfortunately, not all doctors know about these exercises, so not all patients are informed. That's why I decided to make this video. Please use the exercise, recover, and most importantly, stay healthy. The sciatic nerve is one of the longest and largest nerves in our body. Because of this, it has certain vulnerable points where it can be compressed. Friends, do the exercises I show you today day after day, and you'll notice how your muscles gradually relax. Trigger points and areas of tension disappear. Your sciatic nerve is released, and your overall condition stabilizes. If you experience flare-ups and remissions from time to time, or for example, you keep going to doctors but the pain doesn't go away, there's a constant pulling sensation, pain in your buttock, shooting pain down your leg, and you can't bend over properly. Or if this problem has hit you for the first time, these exercises will help you recover in the shortest possible time. Please make use of them. And friends, if you enjoy my videos, the best way you can support me and my team is by subscribing to the channel. Thank you so much for that. The main muscle that causes compression of the sciatic nerve is called the piriformis. It is located in the middle of the buttock, runs down from the sacrum, and attaches to the femur. The sciatic nerve passes under this muscle, and when it shortens or is tense, it increases in volume and compresses the nerve. This causes localized pain in the buttock. The pain can spread backward down the back of the thigh and even reach the lower leg. Some of my patients even feel pain in their heel. So if you have symptoms in any of these areas, please do the exercises I'll be demonstrating today. In addition to pain, people may experience tightness, limited mobility, and restricted bending or turning. Or for example, someone who used to be able to cross one leg over the other now can't do it. This symptom is also typical of sciatic nerve compression and tension in the piriformis muscle. In addition to working on our piriformis muscle now, getting rid of trigger points, making it more uniform, making it softer, please let me give you one piece of advice to incorporate into your daily routine. It will greatly increase the effectiveness and speed up your recovery. Please try to sit less. That is, as much as possible, try to either lie down, stand, or walk. We avoid sitting, and especially avoid crossing one leg over the other. So friends, let's take a massage ball. You can use a baseball or tennis ball, but I weigh 70 kilograms, and a tennis ball bursts under me. So I usually use either massage balls or baseballs. So what do? We take the ball and place it under the glute, right in the middle of the buttock, exactly where the piriformis muscle is located. We straighten the leg on the side where we're going to press on the piriformis muscle. Then, by moving left and right, you need to find the most painful spot. For example, you find a trigger point, press on it, meaning you press the ball into that area with your pelvis. It hurts. That's it. Completely relax, gently press the ball, and stay in this position for 1 minute. You can even set a timer for yourself. This way, we are mechanically softening the trigger point. After lying there for a minute, start looking for the next trigger point. Once you find the second trigger, hold it for 1 minute as well. Then move on further. And so, for example, some patients have just one trigger point in the piriformis muscle, and that's what causes their pain symptoms. Some people have 2, some have 3, some have 5 trigger points. So the more areas of tension you find in your muscle, the longer this exercise will take for you. That's it. The most important thing is to work at the edge of pain, painful but tolerable. If the pressure is too light, meaning if we go too easy on ourselves, it won't have any effect. If we press too hard and the pain becomes unbearable, the muscle will tense up instead, and we won't be able to work it out properly. So we need to maintain that balance, painful but tolerable. And after self-massage, by the way, you might experience a slight flare-up, shooting pains, tingling, or pain moving to different areas. This is a predictable muscle reaction to the treatment, especially if you haven't really done massage before, haven't seen a specialist, or haven't massaged this area yourself. So don't be alarmed. In such cases, you should take a break for a few days, and you can warm up the glute area, for example, with a heating pad for 20 minutes, 2 or 3 times a day. And once the flare-up subsides, you can continue the work. If there is no flare-up, then you can immediately move on to the next sessions. So you should do this either every other day or 3 to 4 times a week. Do whatever is comfortable for you. However you feel, that's how you should do it. So, friends, This is how, in a simple way, we press on our piriformis muscle. The exercise isn't active, but it's very effective. We're mechanically breaking up the most tense areas. With the second exercise, we need to stimulate blood flow in the gluteal area, relieve the overall trigger tension from the glute muscles, and additionally work out the piriformis muscle. We take a massage roller, place it on the floor, press one glute against the roller, and use the other hand to support ourselves on the floor for balance. Shift your body weight to the same side where you'll be working. You can rest your hand on your knee, or if it's hard to keep your balance, you can also support yourself on the floor and perform forward and backward movements, forward and backward. At some point, you'll feel the piriformis muscle snapping over the massage roller. Friends, you can do these kinds of movements. If you find a painful spot somewhere, you can pause there and move side to side. You can twist your knees a little and do forward and backward movements. Or, on the contrary, you can take a more neutral position and do forward and backward movements to work the entire glute. You can move the roller higher to work the upper part of the glute, or lower it down, all the way to the sit bone, the bone we sit on, and work that area as well. Please spend at least 3 to 4 minutes on your glute area. That would be great. After you've done the exercise, worked through the tension spots in the piriformis muscle, and massaged the entire glute area, please warm up your glute. That means either heat up a rubber heating pad or an electric heating pad, place it on the area, then lie down with your glute on it. Set a timer for 20 minutes and just relax. Friends, please do this simple set of exercises. Take care of yourselves and your loved ones. And I'll see you in the next videos. Thank you.